In this lesson, we'll review some key information to help you understand the role of documentation as it relates to billing and provide tips to improve the accuracy of documenting a clinical encounter. After completing this lesson, you'll be able to list at least 2 possible repercussions to poor documentation, explain the correct way to sign your chart entry, describe 1 key characteristic of multiple providers making notes in a patient's record, and define the main purpose of a compliance plan. If a clinic service isn't documented in the medical record, it's like it didn't happen. Besides documenting for billing purposes, proficient charting is a key part of the continuity of care for your patients. Any other provider on call should be able to read your notes and understand what happened during the patient encounter. Accurate documenting also facilitates compliance. That's because billing charges are most likely to be correct for the actual services rendered when those services have been properly documented. Conversely, errors are often due to inconsistent, incomplete, or illegible charting.
Hi, Athena Kinsley, Health Insurance Specialist, here to share an example. I'm going to explain how documenting affects reimbursement. In a certain county, they were having trouble getting one payer to reimburse them for the nurse visit, which was billed along with pregnancy testing services. The billing team discovered this payer had a pattern of rejecting these double service claims. Clinic providers helped their billing staff identify several chart notes that clearly showed justification for a separate nurse visit, in addition to the pregnancy tests. These notes were submitted along with the appeal. As a result, the payer changed their system. They stopped automatically denying these additional visits, provided the appropriate justification was supplied by the clinic.
Typically, payers have different rules for defining medical necessity. The confusion can result in more claims being denied. However, when the medical record is properly documented, claim denials tend to fade away. In most cases, complete and accurate documentation will provide the justification required for a payer to reimburse medically necessary procedures as they define them. Medical documentation should be complete and legible. Each clinician who sees patients, including physicians, nurse practitioners, medical assistants, and public health aides, must document their own services in the patient's record. Each entry should be able to stand on its own. For example, another provider should be able to easily understand the sequence of events later on. Signing means adding your full name and your credential, for example, Nancy Brown, RN. Developing a compliance plan can help protect the clinic and individual providers during an audit, but is also designed to prevent problems from happening by creating good procedures. A compliance plan spells out the department policies and procedures for preventing, detecting, and eliminating fraud, waste, or abuse. Compliance plans tend to contain a considerable amount of detail. To help you learn more, you may refer to the downloadable job aid Compliance Plan Reference for some basic information. Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.